Let's discuss now with infectious disease epidemiologist and senior scholar at the Johns Hopkins Center for Health Security, Caitlin Rivers. Caitlin, grateful for your time today. When you hear Dr. Osterholm there, and you recently co-authored a paper on these variants and what to do about them, when you hear Dr. Osterholm saying essentially check back early to the middle of March to see if we are winning or at least competing well in the race against the variants, walk through exactly what that means.
Well, we know right now that case counts are falling. Those improving trends are starting to slow down, and so we need to push them down even further. But in a few weeks, we'll have a better sense of how those variants are becoming established in the United States. I think Florida is the place to watch right now. They have a higher fraction of cases attributable to the variant first identified in the UK than the rest of the country. And so we may get a sense early from Florida how these variants will interact with our outbreak here in the US.
That's a great point. We'll keep an eye on Florida. And there's also this new variant in New York that's making its way through the Northeast. I want to read a little bit of our reporting on that. Two separate teams of researchers said this week they have found a worrying new coronavirus variant in New York City and elsewhere in the Northeast that carries mutations that help it evade the body's natural immune response, as well as effects of monoclonal antibody treatments. Genomics researchers have named the variant B.1.526. What is the significance either of this individual variant, if that is the issue, or just the fact that there are more and more of them springing up that complicate the chase?
Those new reports about the so-called New York variant or California variant are hot off the press. And I think the scientific jury hasn't even heard the case yet, so to speak, let alone issued a verdict. So we really need more evidence to dig into whether those variants have any changes that are meaningful to public health. But I think regardless of whether those variants are confirmed to be problematic or not, it remains true that this is an ongoing challenge that we will need to manage. But it doesn't need to be an emergency. I think we can put in place the scientific infrastructure to find and characterize those variants and adapt our public health response to match. It's what we do for flu, influenza, and that's what we can do here as well.
And in the paper, you helped write about how to deal with this. I just want to go through some of the recommendations you talk about here as we deal with these variants. Number one, continue public health measures to slow transmission, prioritize contact tracing and data collection, develop genomic surveillance strategy and coordination network for genomic surveillance and characterization. It has been depressing to hear from the experts how far behind the United States is when it comes to genomic surveillance and the like of that. As you went through this paper assessing the challenges for the weeks ahead, what jumps out, what is most important for anyone listening out there who hears about the variants? Some people, for example, say, oh, why get a vaccine now? It might not be any good about these new variants. How should the average American be processing this?
Well, it's really a scientific question right now of how we create the infrastructure to be able to find and track these variants. But as it relates to public health, all of the tools and measures that we have been taking all year still work. The variant that is most commonly circulating in the US, the most common variant of concern, is still perfectly good against the vaccines that we have. And even the other variants that we're a little bit more worried about, they're circulating at such low levels that it doesn't need to be top of mind right now. If we continue to push down transmission with the masks and the social distancing and avoiding gatherings, I think we can get to a better place and we can aim for a more normal summer.
Caitlin Rivers, grateful as always for your important work and your insights here. We'll continue the conversation as we deal with this challenge coming ahead. Thank you so much today.
Thank you.